it's interesting that you brought up using apps and the like to help soothe and probably get better sleep. I know there's definitely an app out there to do that. As you know, we invest in technology startups, and as I look through our portfolio of our underlying companies, I'm seeing an uptick in technology companies trying to solve for mental wellness issues. I think when we chatted, we talked about on the consumer side, we have a company called Wobot, which is using artificial intelligence and chatbots as virtual therapists. And then we also have companies like Calm, which is the guided meditation and sleep. And so, you know, also from a business to business perspective, we're seeing companies, you know, offering companies and corporations, large corporations, the likes of Starbucks and Lyft and Uber, to help them help their employees. So through an investment in Kleiner Perkins, we have a company called Modern Health. And then also it's basically a virtual professional therapists and coaches and to help their employees. And more recently, one of our investments in a fund manager called IVP just did a round in Lyra Health, and that's again providing mental health benefits for employees and their dependents. What is your sense and what's your view in terms of virtual therapist? You're probably practicing that right now. So
yeah, definitely.
Does that work? Like, what are some of the merits and some of your concerns using that platform?
Yeah, so I can say yes. I mean, during COVID, I am using virtual therapy with all of my clients. I'm no longer seeing anyone in person. The Howard Counseling Center, the campus was closed, so we did have to go to a virtual platform. In my private practice, I'm no longer seeing people in the office. I'm seeing people virtually. So I think I think of it as a viable alternative when in-person therapy is not feasible. And of course, this is an unprecedented time, so no one would ever have predicted that, you know, this would count as in-person therapy, you know, not being feasible at this time. But certainly this time it's necessary. And then there are other situations even prior to COVID, you know, depending on where someone is geographically, you know, there may be a shortage in therapists in general. And so being able to access a therapist virtually is also quite effective. Now, as I said, I consider it an alternative, a viable alternative when in-person therapy is not available. You know, so of course there are some drawbacks, and that, you know, that is, you know, most therapists, no matter what their orientation or that is their philosophy in treatment and intervention, would likely say that, you know, the relationship between client and therapist is the foundation of the effectiveness of treatment therapy. And as you can imagine, you know, there are things that you can relay in person that are hard to even relay, of course, when you can't see someone, but of course, you know, even to have to see someone through a screen, it can be quite different than the in-person contact, just in terms of the feel of it. And sometimes it's hard to put into words. But I know, for example, you know, basically, if we were to kind of frame it in a more concrete way, you know, tracking facial expressions, basically with technology, sometimes it can be difficult to clearly hear someone in the same way that you'd be able to hear them behind a closed door in an office. So basically a lot of the nonverbal cues that we all even unconsciously rely on, especially, you know, in therapy, can be a bit muted, let's say, you know, even virtually, even when you are seeing someone through a screen. So those would be the drawbacks, but nonetheless, I think at a time like this, especially where we just can't see someone in person, you know, it's definitely a viable alternative.